Hi, this is Dr. Richard Shore, and we are going live on YouTube. We have a guest who's going to call in today. His name is Dr. Tony Tsai. He is a reproductive endocrinology specialist in Flushing, New York, which is part of Queens if you're not from the New York City area. He has his own practice. He also is um, the president of the American College of Obstetrics and Gynecology in Queens. And we're going to be talking about some reproductive issues, male and female. And we're also, interestingly, he told me today that during this time of COVID, people have uh, not been able to get into their OBGYN. So if you think about the the horrors of COVID, imagine being pregnant and in the later stages of pregnancy and you can't get in touch with your obstetrician, uh, either because maybe they're sick or maybe they're just not seeing patients in their office and so on and so forth. So Tony or Dr. Sai is seeing patients. He's filling that role. He's filling that void. He's putting himself in harm's way to take care of a vulnerable population, a population that needs help. So we're going to talk a little bit about that, and hopefully we'll be talking a little bit about the reproductive issues. So I don't recall how I met uh, Dr. Sai, but we've been working together for about 2 or 3 years. Uh, and so I do the male factor, he does the female factor, the IVF, the ICSI, the insemination, and so on. So typically, what happens is when he has a couple and the male has a significant factor, either very low sperm count or no sperm, which is called azoospermia, he'll send to me and I will do the evaluation. So uh, oftentimes that evaluation will end, and that's just him here. Tony, hey, what's going on? I'm going to put you on speaker. Can you hear me?
Very, very good. I can hear you fine.
Excellent. Okay. You are on live. Um, you were on live YouTube with me, and I was just giving an introduction about what you do and about the role you're filling right now, which is uh, uh, as an obstetrician filling in for women that are unable to get in touch with their OBGYN and they're in the later stages of pregnancy. So, do you want to talk about that?
Oh, thank you very much, Dr. Richard Scholl, for bringing me on this program, especially during this very trying times of this COVID pandemic. Um, as you know, we as physicians find it as our um, goal and as our duty to serve and be available to the public, and for me myself to be available for the women, especially the women of New York during this trying time. So I'm also not only the fertility doctor, but I'm also the chairman of the American College of Obstetrician and Gynecology in District 2, Section 3, which is the Queens District. And so in my role as the chairman, my feeling is that it's my obligation to show leadership and to remain open during this period of time and to have my services be available to the patients whose obstetrician and gynecologists are have closed their facilities for whatever reason, whether they've succumbed to COVID themselves or that their staff is unable to allow them to open. So I want to make sure that patients know that there are doctors available and they should reach out to their physicians to find out who's available to help them out during this period of time.
Have you been doing deliveries?
No, I don't do deliveries. So I am the director also at the New York Presbyterian in Queens. So we do have doctors on staff that will perform the deliveries if their doctors are not
I see.
available.
Okay. Okay. Yeah, I mean, I can imagine the stress. I get calls from patients, with urologic emergencies, urinary retention, kidney stones, urinary infections, and so on, and they are panicked at the thought of having to go to the emergency room. Understandably, uh, but I can't imagine